So that meant that every time you positioned a patient, they always slid down the chair and you always had to have them slide back, right? So this chair, if you look on the back, it's got a, what we call right here, this curve. It's called a virtual pivot, okay? What we want to do with this chair, we want it, because it's all designed around ergonomics, and if we don't position them correctly, if the headrest doesn't work properly, that means you guys are going to do this to look into the oral cavity. That means the assistants can't see. That means everyone's out of position. Okay. So when we come in to seat them, we want to put them in here. I want to slide them all the way back so that they're getting, the patient's getting lumbar support on the very back. I can put someone as my height in here. I can put someone as tall as your husband in here. And their feet will never hang off the end, as long as we slide them all the way to the back. When we do that, we want to pull up the headrest here. Depending on the torso length and the neck length of the patient, we want to then adjust this up and down. We're going to push this button here, and then this allows this to come in and out and go this way as well. What we're going to do is we're going to take this curve of this headrest, and we're going to place it at the base of the occipital. Okay? The reason for doing that is now I've got support, patient support, so that their chin's up. No need for pillows. Have you guys ever done that before? No need to do that anymore. Okay? Patient's going to be very comfortable, but more importantly, everybody has line of sight to the oral cavity when we're working, instead of trying to figure out, am I looking at the top of the doctor's head, or if I'm looking at something else. Another part of this headrest is I can actually slide this up.
Wow.
And I can slide this down. This is giving me the ability to articulate the patient's head. So if I'm working in the lower quadrant, left quadrant, and I want to kind of get a better look at a lingual surface, maybe I just do this and it pushes their head down, or I push it up, depending. Okay. Now that's also based on patient's mobility. If they're older patients, maybe they don't have that ability to do that. You don't know. Okay. So once we've got patient here, you have different armrest positions for the chair. You can have them all the way to the front. By doing this, let's say if you had to come in doing an exam from the front, this is cut away here so I can get in closer. Okay? But it also gives me the ability, if I'm seated, that the casters can actually get in closer. Okay? So that you're not either stepping on the side of the foot base of the chair, but you can also get in closer because the chair allows you to get in closer. The idea is we don't want you working out here, we want you working here next to the patient. Okay? All about ergonomics and keeping everybody's back healthy, right? So, once we've got them in here, then depending on the size of the patient, you can either have them, the armrest in this position, you can fold them down this way if you choose to, or you can ratchet them up. You'll hear that click, go right about here, and that's where they would reside.
Where do you click?
When they're down, you're just going to hear it go about halfway, and then it stops. Okay? What I would recommend is, because typically this is the side patient comes in, is either way, whatever you want, just make sure when you're exiting them, you drop the armrest out of the way, because otherwise they're going to try to push themselves up on it, and if they're a bigger patient over time, we could break them. It's not designed to break, but we've had that happen in the past, so just note to self, okay? Okay.